The following dramatization presents two ill-structured clinical scenarios. It's not intended to model, but rather to promote critical reflection and group discussion on the reality that we are faced with when family expectations conflict with our sense of professional duty and ethical responsibility. How we engage and integrate a diversity of cultures and expectations can be central to how a patient and family understands and responds. As you watch the segment, consider the following questions. What is happening? What issues does it raise? What emotions come to your awareness? What implications does it have for how we practice?
Dr. Johnston.
Yes?
I'm Joel Singh, Mrs. Singh's son. You're seeing my mother today, right?
Yes, I am.
Wondering if I might speak with you for a moment about my mother.
Of course. What is it you'd like to talk about?
It's about the cancer. She knows she's sick, but she doesn't know how sick she is. Well, we'd like to keep it that way.
I'm sorry, Mr. Singh, but I don't work that way. She has a right to know about her cancer and her condition. I have to tell her about her treatments and what we can do for her.
But doctor, that's not how we do it in our culture.
I understand, but I have to talk with her. Now, I have about 10 minutes before my next appointment, so let's talk with her now.
Now, let's review the scenario again. Consider the following questions as you watch. What is happening? What issues does it raise? What emotions come to your awareness? What implications does it have for how we practice?
Dr. Johnston.
Yes?
I'm Joel Singh, Mrs. Singh's son.
Oh, pleased to meet you.
I was wondering if I might speak with you for a moment about my mother.
Of course. Would you like to talk in private?
If we could, yes.
Okay, there's a room down the hall where we can go. Follow me. Now, Joe, what would you like to talk about?
Mother knows she's ill, but she doesn't know or understand how ill she really is.
But she's been told the tumor was cancer.
Mother doesn't understand English very well, and when the surgeon told her about the illness, we translated for him. We left out the part about it being cancer. We told her that it was a tumor that the surgeon had removed. And now we're afraid she'll figure it out with the doctors like yourself talking to her.
I don't understand. It's my belief that it's important for her to know about her illness, that there are treatments available. And some of those treatments could make her relatively uncomfortable.
Yes, I know. And this may not be easy for you to understand, but in our culture, it is preferred that the patient not be told. It is the duty and the responsibility of the family to look after the patient. We are to see that her journey is as easy as possible. It is a matter of respect and honor.
And you feel that this is what your mother wants?
Yes, this is what she did when her husband was sick with heart failure. It is a long respected tradition, and Mother is very traditional.
But Joe, I still have to arrange treatment for your mother. How can I do that without telling her what's going on? How about trying this with me? We'll both go in to see her. And I'll ask her if she'd prefer that the family be told the details of her illness, and if she'd like them to make decisions for her. And if she agrees, then that's how we'll proceed. But Joe, you must understand, if she asks me any questions about her diagnosis or prognosis, I'm obliged to answer them.
Of course you must answer. That's also respectful.
Okay, shall we go talk with your mother now?
As the second scenario illustrates, being receptive to family concerns and exploring underlying interests, such as the hopes, fears, needs, desires, and concerns of patients and families, as well as important values, is one way to more effectively engage a family. It is possible to remain true to our ethical principles and duties as clinicians while honoring different traditions. Cultural competence is obviously more than attending to matters of disclosure and autonomy, but we can demonstrate our openness and willingness to engage families with these issues. Respecting different traditions and adapting our communication to those principles is likely to result in a better outcome for the patient and family. It contributes to creating an environment of comfort, dignity, and peace of mind.